welcome to the It Hurts to Mom podcast. I'm Lauren Rose, and today we're talking with Dr. Elizabeth Davidson, a functional medicine practitioner who solved her chronic pain and who combines functional blood work, brain and nerve health, plant medicine, and lifestyle consulting to find the roots of what is disrupting your health. So, Dr. Davidson, you had pain that started at a very young age. Tell us about that.
I did. I started getting migraines when I was 4, and then my joint pain started when I was 7. And I wasn't able to walk that summer that I was 7, and
Wow.
everything just kept going from there. So by the time I was a teenager, I was pretty much just not really functioning. I mean, I could make it through my days, but not with anything extra, you know? So yeah, it was not fun.
So you talked about you couldn't walk and you could barely function. Were there any other ways that your pain and illness affected your life back then?
Well, you know, being in pain all the time, especially with the headaches, like I had headaches every day, pretty much just had a migraine from, you know, the time I don't know, I had a lot of them starting when I was 4, but then by the time I hit puberty, it was like just one whole. So when you're in pain like that, it's really hard to function as a person. Like I could, you know, go to school, I could, you know, eat and somewhat sleep. I was never a good sleeper, but I couldn't really have a social life. Like it's like living in a fog all the time. Like there's just these clouds. I felt like there was always clouds between me and everyone else. So yeah, it was really difficult to have friends, to go do things. I grew up in a real small town, and I remember like in 8th grade, so there were 5 girls in my class.
Wow.
Yeah, like really small. And in 8th grade, all the other girls, the other 4 girls in my class, went to a Vanilla Ice concert together, and I was not invited. And that was really typical of like my social life growing up. And, you know, kids can be mean and whatever, but it wasn't just that people were being mean and excluding me. And it wasn't that I really wanted to go to Vanilla Ice concert, but it was that I couldn't connect because I was just in pain. And that was, I mean, if you've been in pain, which I'm pretty sure you have been, it kind of becomes your primary, like what your life revolves around, you know? And it's hard to do much else like past managing that and getting through your day.
Right. Yeah, I've had chronic pain for almost 30 years, and it started with migraines. I mean, near daily migraines for about 25 years. So yeah, that's then it ended up with joint and body pain. So back at the time, so what were doctors doing for you to manage your pain at ages 4 through 10?
Well, when I presented with migraines at 4, they told my mom it was stress. I needed to reduce stress in my life as a 4-year-old.
Yeah. Great.
When the joint pain started, they said it was a virus and told me to just not walk for several months as a 7-year-old. They gave me a lot of antibiotics, but I had other things too. I had bronchitis a lot. I had, of course, after all the antibiotics, wound up having gut issues and skin issues and all of that, which I'm still recovering from many years later. They didn't really know what to do. I mean, I got given some pain meds at some point, but I also have very bad reactions to pretty much any pharmaceuticals, which I think is kind of typical of people who have migraines and chronic pain and stuff like that. I've seen it a lot in my clientele, but pretty much anything that's supposed to get rid of pain throws me into such horrendous pain and headache that I would rather die than take it. So, so it's easier, like it's less painful to just be in pain than it is to take the medications. And I do have a family history of being very sensitive to stuff like morphine and all of that. Like it has almost killed my mom and my grandma before. So I have to avoid anything related to that.
So is that why you started refusing medication at 10 years old? Because of
Yeah.
the reactions?
Yeah. I mean, I was recognizing at that point that every time I took a prescription, I felt worse. And I was already feeling bad enough. I didn't
Hmm.
want to feel any worse because, I was always trying to get better. I really was always driven in that direction. And recognizing that something was making me feel worse, it's like, well, no, I don't care what the doctor says. Doctor doesn't live in this body. I care about what I'm feeling, and this is not helping.
So what did you start doing instead when you stopped taking the pharmaceuticals? Did you do anything at that time when you were young?
Yeah, the first thing that I started working with was just my diet. I don't think anyone had really called them elimination diets yet, but I started doing elimination diets when I was 10, like just taking one
Wow.
food out at a time and seeing what happened. Um, I didn't have any huge crazy results with that. I mean, a couple times like my skin issues got better or my digestion got better. It didn't really affect the pain and the headaches that much. But it was, kind of the start of really looking internally
Mhm.
at what was going on rather than externally. Because, most of our medical system tends to be external. Like they want to diagnose something wrong with you so they can put a medication on that and call it good. So that's coming from the outside in.
Mhm.
And I recognized real young that my health was coming from the inside out. So I was always trying to like tease that out more and figure out how to support that inner well-being. Um, and the first thing I went to, yeah, was food, because I mean, it seems pretty basic, right?
Right. How did your parents feel about you trying alternative medicine and stopping the pharmaceuticals?
It's hard to remember really, but I did grow up in a family that was always pretty holistic. Like we grew most of our own food. We lived out in the woods, got a lot of fresh air. We didn't have lawns, we had gardens. We never had like chemical shampoos or anything. We shopped at the health food store from the time there was a health food store. Um, so I feel like I already had that mindset of, that getting toxins out of my life, like not really having those, eating a whole food kind of diet. And so, and I was also like quite stubborn. So it was, they couldn't really argue with me. I always like, before I do anything, I always have lots of reasons to back me up. So even at 10, I was like, I can't take these anymore because of this and this and this and this and this. And I had it all listed out. So there was no like, I don't know, maybe I should have been an attorney. but, I couldn't really say no because I had it all reasoned out. Yeah.
Yeah. So it sounds like alternative solutions weren't that far of a stretch from how you guys were already living anyway. So,
Um,
um, so what alternative solutions started to help you?
I guess I had my first big breakthrough when I discovered very gentle chiropractic. It was
Mm.
network chiropractic care. So there's no twisting or cracking, which if you've ever had twisting or cracking as someone who has chronic pain, probably just made you hurt more, which it sure did
Yeah.
for me. Um, so what network chiropractic care is all about is really helping your brain and body communicate better through maximizing your nerve function. That's why my email is happy nerves. um, and so that really got me out of the daily migraine cycle, which was such a huge deal.
Yeah.
So life-changing to suddenly not have them every day, more like once a week rather than every day. And
Yeah.
um, so that was really big for me. And that's what spurred me to then go on and get my chiropractic degree so I could do that for other people.
Yeah. I was about to ask if your chronic pain and illness led you to want to become a doctor.
Oh, yeah. I mean, my whole life has been searching for solutions to chronic illness for myself. And
Mhm.
so that certainly turned into my career because I wasn't really doing anything else. So I just kept going to college, kept getting degrees and more certifications, and learning how to help myself first, and in turn helping others. So yeah.
Great. So tell us a little bit about functional medicine, what it is, why it's important, what you do.
Yeah. Um, so, I mean, you've had some chronic pain and migraines and stuff. When you go to the doctor and they see you for like 10 minutes and then they maybe look at your blood work and they tell you everything's normal and you're fine, and it's all in your head, or you just need to reduce stress. Does that sound familiar?
Oh yeah.
Yeah. And I feel like especially as women, we get you just need to reduce stress. That's where all your symptoms are coming from. And they don't really give you any solutions. So with holistic and functional medicine, it's more about actually finding the reasons for things that are going on and looking at all your health as a whole system, not just like, oh, you have headaches, let's see if there's anything wrong with your head, let's do an MRI, let's take your blood work. No, oh, there's nothing wrong with your head, must be fine.
Right.
So it looks at the system as everything is connected and looking for actual reasons why. So like one of my certifications is as a functional blood work specialist. And I got that after becoming like the brain and nerve specialist as a chiropractor. And that really like fit everything together in such a cool way, because most of the time when you have your blood work read, all the numbers are in normal range. And even if they aren't, it's no big deal.
Right. Exactly. Yes.
So I don't just look at the normal ranges in the blood work. I look at the relationships between the ranges, between the numbers. So when you look at the relationships between the numbers, you can really unpack a lot of what is going on kind of behind the scenes in the blood work. And so what I find consistently with things like chronic pain and autoimmune disorders is that the white blood cells are showing a lot of signs of infection. And the white blood cell count, like the total count, may be normal. Lots of times it's not. Lots of times it's low or high sometimes. But when you look at the different types of white blood cells, and by that, if you have any blood work, you can look this up, but neutrophils, lymphocytes, monocytes, eosinophils, and basophils, those are the 5 types of white blood cells. If you look at those and look at the ratios between them, you can see that lots of times with autoimmune, I find bacterial, fungal, viral, and parasitic infections all going on at the same time. And so like, if you think of having all those infections, like that you're fighting all the time, no wonder you can't function like a real person. Like, no wonder you have headaches, or no wonder you have joint pain. No wonder you're tired all the time. No wonder, like, that's so much internal stress. So when people say you should reduce stress, I don't think of it as reducing like your workload or your kid load or all of those things that you can't really reduce. I think of it as, oh yeah, you need to reduce the internal stress, because lots of times there's so much internal stress going on with all of those infections that's what's making you result in having stuff like chronic pain, migraines, autoimmune disorders, all of that. No matter what the diagnosis is. Do you want to hear my little rant on diagnosis?
I would love to.
Okay, so diagnosis is really just a name for a collection of symptoms. And putting a name on it makes it, 1, easier to match a medication to it, but 2, it makes it easier for you to own that diagnosis. And I get that there is some relief in getting a diagnosis because you finally have a name for what's going on. Right. But does that name do anything for you? Most of the time, I would say it doesn't do anything for you, because it doesn't give you the underlying cause for that diagnosis. So as a functional and holistic doctor, what I look for is the underlying cause. And lots of times, no matter what the diagnosis is, the underlying cause is pretty similar for all of these things. Fibromyalgia, lupus, rheumatoid arthritis, migraines, like you name it, it's a chronic fatigue, all of these things. It's usually a set of infections that your body's constantly trying to fight, and it shows up in your blood work. So that has become really foundational in my work to help get people well.
Yeah, that's so interesting because I get blood work every few months, and my inflammation rates are always really high, but some of my neutrophils and some of those are off, and I've always got some things that are off, but the doctor says, oh, it's not a big deal, like you said. And they diagnosed me with autoimmune disease. I had one doctor who, because I was like, well, which kind? He was like, well, I believe all autoimmune disease is just singular. I don't believe in giving it more of a specific name, because autoimmune disease affects your whole body. It turned out, I moved, so my next rheumatologist said rheumatoid arthritis, because she couldn't think of a more appropriate diagnosis.
Right.
But yeah, it's really frustrating with doctors, because they say everything's fine, even though things on my blood work are showing up abnormal. And I've had about 5 or 6 doctors tell me, I don't even know what else to do with you. We've tried everything. So I started getting into functional medicine a little bit several years ago. My dad became very obsessed in later in life with nutrition and holistic living and things like that. So I started just looking into that, and I still see regular doctors. I have an appointment with a functional medicine doctor in November, but it's hard to find a functional medicine doctor because most of them don't take insurance, and so then that becomes expensive. But I definitely think that like you said, everything in your body is connected. It's all related. So something might be wrong, with my, gut issues, and I'm having migraines or joint pain or whatever it is.
Yeah.
I
like what that one doctor said about it not being any particular autoimmune disorder, that autoimmune is systemic, and that's what's going on. Like, that really makes a lot of sense. But what autoimmune is your body's basically fighting itself. Like, it's just so overwhelmed with all those infections that it's creating more antibodies to try to fight the infections that wind up attacking you. And so, like, I know one of the diagnostic criteria for some autoimmune disorders is the anti-nuclear antibody. And that's like going crazy. But then when I look at their white blood cells, I'm like, okay, but you also have bacterial, fungal, viral, and parasitic infections. So no wonder your antibodies are freaking out.
Wow.
And so by taking care of all those infections, then everything can relax, and in turn you get out of pain, which is so fun.
So why do you think that most Western medicine doctors don't look at blood work the same way that you do?
That is one of the big mysteries. I don't understand a lot of things about Western or allopathic medicine, just because most of it is very mechanistic. It looks at, pieces of your body one at a time. And I, again, kudos to that doctor who said that autoimmune is systemic and it's all one thing, because that's unusual, I find. And where I come from with the chiropractic and the holistic and the functional, everything's vitalistic. So everything's connected. Like, if your knee hurts, it could be because your gut is out of whack, and that could be because you took antibiotics when you were 4 years old and it threw everything off and you never recovered from that. Like, it's all a progression. And also, I do believe that our bodies are always doing the best they can with the information that they have. And so from a holistic point of view, I don't think there's anything wrong with you. Your body is just trying to survive with what it's got going on and fighting it the best it can, and getting you through your days and getting you to do hopefully most of what you need to do. But it's always going to do its best with what it has going on. So when we give it better information, when we rebuild that foundation of health, then it can do even better. And so I don't look at symptoms as being something wrong. I look at it as kind of like the check engine light on your car. You have a symptom, then you want to check out like what's going on behind that. So if it was your car, check engine light comes on, what would you do?
Check your engine.
Yeah, you take it to the mechanic, have them run that computer-y thing and figure out what's going on. But so many times when you go to a doctor, if you have a symptom, they're like, okay, well, let's cover up that symptom with a medication. And really that's akin to putting a piece of duct tape over the check engine light. And it doesn't get you anywhere. And then of course, when you cover that up, then more problems are going to happen. If you cover up your check engine light, then something's going to be, you know, if it's a sensor that's off, then that's going to throw off like your exhaust system probably, and so on until your car's just broken. And it's the same if you cover up like, oh, you have joint pain, let's put you on tramadol. Okay, but then you covered up that symptom, so now you don't have the check engine anymore. So what else is going to get thrown off from there? And then plus, of course, medication, those are always really rough on your body. So yeah, my dad was
always obsessed, and he got me to, you know, start asking my doctors like, well, what's the cause, right? What is it that is causing, you know, my joints to hurt or my muscles to hurt or my migraines? He was very, you know, obsessed with just the root cause. And so he got me to start asking that question. And most of the time doctors just say, well, we're not really sure. We don't know.
Yeah, well, I know, and I can find it. I can show you how to find it. And that's one of the things. So I recently created an online course, and one of like the first module is all about teaching people to read their own medical records from a functional point of view, so that you have that power. And then you can help yourself, like anytime you get a new blood draw or whatever, you know what to look for. So you have more power when it comes to either talking with your doctor or just knowing what's going on. And of course, then you can help your family too, which is pretty nice.
Yeah, that's awesome. So what advice would you give people who are struggling to improve their chronic pain and illness?
Well, I guess the first thing is that whatever you think is going on with your body, you're right. And don't let any doctors tell you that you're wrong. Because myself, and then pretty much everyone I've worked with or even talked to about chronic illness, they've gone to so many doctors who have just kind of dismissed what's going on. Or like we were talking about earlier, oh, you're normal. They're like, but this and this and this. I'm like, yeah, well, nothing's showing up, so you're normal. So trust yourself, because you know your body better than anyone. You live in it 24/7. And if you feel like something is happening and your doctor just dismisses it, get another opinion. And also, if you feel like there's something that you want to try to get well, whether it be something nutritional or go see a functional medicine doctor or whatever it might be, if you feel it's really right for you, do it, because you're right. And we're all very intuitive, and we tend to brush that under the rug because we're not taught to believe in it. I also took a very long clairvoyance course. And so one of the biggest things I got out of that was that we are all intuitive, and we know on a deep level what is going on and who we can trust and how we can get help. And so don't ever second guess that. Do get another opinion, especially if you don't like the answers that you're getting or the treatment that you're getting. That is super important. So those are two of my top tips.
That's great. I went to my primary care doctor, an old one that I don't see anymore. And I had a list of symptoms. I mean, it was probably 20 symptoms of just things that were not normal for me.
Yeah.
And she completely dismissed me and said, "Oh, those are all just from your depression." And then I ended up going to a rheumatologist, found out I had autoimmune disease. And I mean, I was already upset that she dismissed me. And, she didn't even read all my symptoms. She just kind of glanced through them and just brushed it all off to depression. And so, yeah, it gets really frustrating dealing with Western medicine doctors.
It breaks my heart. Just, I've heard that so many times. It's either your depression or
Mm,
your anxiety.
mm,
And I've heard it, for myself, and then for pretty much everyone I've ever worked with has been
mm,
brushed off like that. Like, I don't understand, like, having been through medical school and the things that you learn there, I don't understand how you can just do that and then brush people off like that. It doesn't make any sense to me. And I'm really sorry that that happened to you too, because, but you're not alone.
yeah. I mean, luckily, kind of like you, like I knew it wasn't just my depression. I mean, I've had depression for years, and then all these things were new. So I knew in my gut that it was something else. So, definitely, trust yourself. And, a couple of years ago when my doctors just didn't know what to do with me and I was getting worse, that's when I decided, okay, I've got to take my health into my own hands. And so I've been, trying different things, and I go kind of in waves with nutrition and functional medicine doctors. Like I had a great one, and then he moved 45 minutes away, so trying to find another one. But I definitely agree, like we know our bodies and we know what's normal, baseline for us. And doctors can be so intimidating and dismissive, and a lot of times when you go to them with information that you found on the internet or elsewhere, they just kind of roll their eyes like, we don't know what we're talking about. It's like, but if I have a diagnosis, I'm going and doing my research, and here's something from the alternative world that says my stomach acid, for instance, isn't high, it's actually low, and that's why I'm having acid reflux. Um and they dismiss that a lot, so that's definitely frustrating.
Which isn't really even alternative, just what you just said about the stomach acid. I mean, that's how it works. That's science. It's right
Right.
there. It's like proven. It's
Yeah.
yeah, that's frustrating. So that's one of the reasons that I created my course, is because I see the future of medicine, particularly for people like us. Like, do you really want to go to any more appointments in your life?
Not really.
So I created this course because appointments, they take a lot of time and energy and money and all of that. You don't get a lot of results. And I really see the future of our kind of care is being at home and self-driven, because we're not getting the help we need from the doctors. And functional medicine doctors, yeah, they're hard to find. So I want to bring holistic medicine into the home. And so I created this course so that you can see exactly what your medical records are telling you, what your blood work is saying. And then, so the first module is all about that. It's discovering what's actually going on. I teach you how to read those white blood cells, find those infections, and a bunch of other things in there too. And then, so you can reset your whole foundation of health is the next module, which gives you supplement protocols. I don't think supplements should necessarily be used long-term, but these are very focused, like 3-month protocols to give you a jump start into getting rid of infections and boosting your cellular well-being in lots of ways. So supplement protocols, various just things like tips on how to actually get your water hydrating you, because a lot of it is not hydrating us. We're just drinking it and stressing out our kidneys. And so all kinds of just small shifts that you can make throughout your day that are really simple to help reset and rebuild that foundation. And then the third module is all about maintaining that. So stuff like lifestyle, mindset, household tips that can maintain all the progress that you've made and keep that foundation of health strong in your life so that you and your family members can, benefit from it for a lifetime.
That's
So,
amazing. So
and you can do
where
it
can we,
yourself.
oh, I love it. Where can we find more information about your course and about you?
Probably the easiest is just to go to my website. It's drelizabethdavidson.com. Dr. Elizabeth with a Z, Davidson with both the D's, .com. And on there, you'll be able to sign up for my mailing list, which I don't send a lot of stuff out, but when I do, it's really good. And you'll also have the opportunity, you can schedule a free consult with me to learn more. You can find, if you go to the, what page is it? I don't know. Well, if you go to my blog, then there's a lot of information in there and links to my YouTube channel. That's also on the top of my website. And then there's another page that has my course and information about that and how to sign up for it. So yeah, there's that kind of reaches everything. It also has links to my Instagram where I post a lot of things. So that has a lot. And if you just want a conversation, happynerves@gmail.com is my email. So feel free to use that too. But you can schedule it on my website. So yeah.
Awesome. Well, thank you so much for coming on. It's been really interesting and exciting to hear that there are other options besides what we're just being told at the doctor's office.
There are, and they really work. And it's not like it's going to take, 5 years to get you feeling better. Most people who use my protocols feel better within a month.
Wow.
One of my most recent people that I am working with, she's in stage 4 kidney failure.
Oh.
And looked at her blood work, tons of infections, all of that. And I had a check-in with her a couple weeks ago after she'd been working my protocol for about 3.5 weeks. And she was feeling so much better. She was like jubilant. She was so happy. And we barely scratched the surface, but already feeling so much better just within a few weeks. So there is hope, and it doesn't have to take a long time. It's not hard to reset everything so that you function better and regain your health. And then for those of us who have kids too, I always like giving people hope that your kids don't have to follow that. Like genetics are a thing, sure, but you have to have the right environmental factors in order for those genetics to express. If you're more curious about that, read Biology of Belief by Bruce Lipton. Awesome.
Okay.
But I have a 14-year-old daughter, and she's never had a headache. She's never had pain. She's never had depression. At 14, I was suicidal. Her at 14, she's happier than she's ever been. And she tells me that almost every day. So there is hope, and we can change the lives of the generations. This doesn't have to keep happening. We can shift that, and our kids and grandkids and everyone else can be a lot healthier and happier. So.
That's amazing. I'm gonna have to check all that out because my daughter's already got migraines at 9 and headaches multiple days a week. She's got severe anxiety, just like I do. And so of course I worry that she's gonna have depression like I do and chronic pain like I do. So this is very hopeful to me to, know that there are resources out there that can help. Because I definitely want her to have a better life than I did.
Yeah,
let's do
her life. Be happy to help however we can.
Awesome, thank you. And you can check me out at ithurtstomom.com and at ithurtstomom on Instagram, Facebook, and Twitter. Have a blessed day.